Assalamu alaikum wa rahmatullah. It gives me a great honor and pleasure to join you at the 2025 Dower Conference. This is Mohamed Sufyani. I'm an associate professor at the Division of Endocrinology at King Saud University in Riyadh. I was asked to give practical case scenarios about the use of insulin pump during Ramadan. These are my disclosures. So I'm going to focus on two parts: the management of open loop insulin pump during Ramadan, and then the second part of the talk will discuss cases on the management of closed loop insulin pump during Ramadan. So let's start with case one. So this is a 25-year-old young gentleman who's here for a pre-Ramadan clinic visit. We're seeing him 2 weeks before Ramadan. His medical history includes having type 1 diabetes, diagnosed 11 years back, not known to have any other illnesses. He has no evidence of micro or microvascular complications, and he's currently on the Minimid 640G system along with a Freestyle Libre sensor. So this is an example of an open loop insulin pump where the pump does not communicate with the sensor. So there's no automation of insulin delivery nor suspension before low feature. He denies having any history of DKA over the past year. His previous Ramadan experience included breaking the fast 5 days due to hypoglycemia. Yet he's still insisting on fasting this coming Ramadan with an A1C of 7.5 during this visit. So these are his current basal insulin rates on the pump. You could see from 12 midnight, he's getting 1.5 units per hour. During the daytime, that rate is increased to 1.6. So again, this is his pre-Ramadan basal setting. This is his pre-Ramadan CGM data. You could see that he's struggling with hyperglycemia more than hypoglycemia with a time in range of 56%. This is his trend for the 24 hours. This is again before Ramadan, but you could probably appreciate that his glucose drifts down as the day progresses. So it turned out that he is working, and usually at work he's very busy, that he does not eat or snack until he gets home pre-sunset, and that's when he has his late lunch or dinner. And this is just an example of 1 day before Ramadan. Again, you see the same pattern that we saw in the AGP profile. So what did we do for him to prepare him for Ramadan fasting? So we started with changing the basal rate setting. And this is very key, very important, especially in patients who are using an open loop system where the basal rate is not automated according to glucose readings. So we increased his basal rate during the night time, because what we know from different studies that people with type 1 diabetes struggle with hyperglycemia during the night time of Ramadan. However, when it's daytime, we start reducing the basal rate by 10% early morning, and then maybe 20% midday, and 25 to 30% from 2 p.m. Until iftar, or I would say the last 4 hours of fasting. And then after iftar, we increase the basal rate further to take care of the post-iftar hyperglycemia that many of our patients struggle with during Ramadan. And this has been presented very nicely by my colleague, Dr. Nancy Al-Barbary, in one of her papers, where you could again see if your patient is using an open loop insulin pump, you want to reduce the basal rate during the daytime. It is suggested to reduce it by 10% during the early hours of fasting, and then by 25% midday, and by 35% according to this protocol during the last 4 hours of fasting. And then after iftar, basal rate needs to be increased to counteract the post-iftar hyperglycemia. So this was the first case, open loop pump. Another case with an open loop pump, but different system. So this is a 32-year-old female who was diagnosed with T1D at the age of 20. Ramadan fasting, she was planning to fast in Ramadan 2023. And you could see that pre-Ramadan A1C is 7.6. And this is her pre-Ramadan CGM. She's doing fairly well with a time in range of 68%, not much hypoglycemia, slight hyperglycemia. So what did we do during Ramadan? Again, we followed the same protocol that I just explained with case one, but maybe we were a bit less aggressive in reducing basal insulin doses in this setting, just to personalize the management for this patient who we know is highly educated, didn't have any hypoglycemia before Ramadan. So we only reduced the basal rates by 10% early daytime, and then by 20% throughout the rest of fasting. And what we also did for this patient is we intensified the ICR for iftar. As you could see here, her ICR for iftar is 5, whereas for sahur it is 6. And again, this is an attempt to improve the post-iftar hyperglycemia that is common in many of our patients. And here you could see the outcome after Ramadan. Time in range is even better than before Ramadan. And she was able to successfully fast 22 days out of the 24 days that she attempted to fast, with a flat in range line of glucose during the daytime of fasting. With, again, you could see the post-iftar hyperglycemia that is common in these individuals. The 2 days that she could not complete fasting were due to post-sahur hypoglycemia and maybe overcorrection of pre-sahur hyperglycemia. So case 3 would be my last case for an open loop system. This is Mr. Ahmed, who's a 35-year-old gentleman. Again, diagnosed with T1D at age of 20. He works as a teacher. And this time we're seeing a case of Omnipod DASH with Freestyle Libre. You could see the pre-Ramadan basal rate settings, 0.5 units per hour during the night time and 0.6 units per hour during the daytime. And again, glucose is fairly well controlled, maybe with slight hyperglycemia after breakfast during the pre-Ramadan period, as you can see. So what did we do? Again, we reduced basal rates during the daytime, more reduction during the last 4 hours of fasting, and we increased the basal rates during the post-iftar period. And once again, you see his CGM post-Ramadan, this is the Ramadan CGM. You could see that he did very well when it comes to glucose levels. Maybe time in range was even better than it was before Ramadan, with slight post-iftar hyperglycemia, but nothing terrible. What you could also see in this patient is another feature that insulin pumps provide, including the suspension of insulin delivery. But this time, this has to be done manually since this system is not automated. So patient would have to manually suspend insulin delivery if they predict or if they see the glucose is trending down during fasting. So case 4 is a case to highlight the switching from MDI to 7-ATG system, which is an automated insulin delivery system before Ramadan. So this is a 40-year-old woman with T1D for 28 years. She's highly educated. She knows how to count carbs. She's never been able to fast during Ramadan, despite multiple attempts in the past. She was on MDI and Guardian sensor in Ramadan 2022. And she's always had to break her fasting because of either hypoglycemia or severe hyperglycemia. This is her experience during Ramadan 2022 with the NDI and Guardian CGM sensor. She attempted to fast 25 days, could not fast or could not complete fasting on any of these days. You could see just examples of those days when she attempted to fast from MDI and recurrent hypoglycemia on different days, and one day with severe hyperglycemia and DKA, for which she had to break the fast and present to the emergency room. So we saw her in 2023, 3 months before Ramadan, and that was the time when we initiated the 7-ATG system and automated insulin delivery system. And this is important. So for someone who is not or who has not had an experience with the automated insulin delivery system, it is crucial that we initiate the pump therapy and training ahead of time before Ramadan. And this gives me an opportunity to share with you these recommendations that we've developed for users of the 7-ATG system who plan to fast during Ramadan. So one of the recommendations that we provide in this consensus or expert recommendations paper is that the exact timing of a pre-Ramadan consultation can be individualized. So if you have someone who's high risk using 7-ATG system, or a new user, just like this case, it is probably better to provide the pre-Ramadan consultation 2 to 3 months prior to Ramadan. And that's what we did with this patient. We trained her in the system. We initiated the system 2 months before Ramadan. And in Ramadan 2023, she had her best experience of fasting, according to what she said, where she was able to fast all 26 days that she attempted to fast during that year with the use of AID system. And these are just snapshots of her glucose. You could see how flat and in range her glucose was during those days. And here you could just compare the Ramadan 2022 and Ramadan 2023 MDI versus AID system. Not only that she was able to fast most days of Ramadan, but or essentially all days that she attempted to fast with the AID system, but also she had an excellent glucose control in that Ramadan. So the last case I want to share is a case of a patient who had already been using the 7-ATG system for quite some time. And now we're seeing her in the clinic before Ramadan. And this is her first time to fast with an automated insulin delivery system. So a patient who is already on the AID system, but now wants to fast during Ramadan. So in the same consensus report or expert recommendation report that I shared with you earlier, we provide a list of topics that clinicians need to discuss with patients who are using the 7-ATG system and plan to fast during Ramadan. So there are topics that need to be discussed related to diet, activity, lifestyle changes, and so on. But for the purpose of this talk, I'm going to focus on the topics related to the pump setting. So this is our patient. Even before Ramadan, she had an excellent glucose control with the 7-ATG system and automated insulin delivery system. You could see her time in range is 83% with essentially no noticeable lows, and time above range is within target. These are her basal rate settings, or the basal rate setting before Ramadan, only one setting. And this is her insulin to carb ratio. So one of the things that we did, we developed another basal rate setting designed for Ramadan, where we followed the same recommendations that I mentioned earlier. So the basal rate is going down as the day progresses. And also for the insulin to carb ratio, we intensified the insulin to carb ratio for iftar. Again, this is just to show you that there is a long list of recommendations that we provide in this consensus, and I would highly recommend that you go back and go through these recommendations if you have a patient on the 7-ATG system who plan to fast during Ramadan. We also encourage users to continue using this system during Ramadan and follow the IDF-DAR guidelines for other aspects, including the when to break the fasting for hypoglycemia and hyperglycemia. Another particular recommendation that we provide is related to the iftar meal and the need to intensify the ICR for iftar meal to counteract the hyperglycemia that typically happens after iftar. For the sahur meal, you could either keep the same ICR from pre-Ramadan or relax it a bit if your patient is considered high risk for hypoglycemia. We do not recommend any change in the SmartGuard glucose target or AIT or active insulin time for any of the users of the 7-ATG system, unless you think your patient is high risk for hypoglycemia. Then you could increase the SmartGuard glucose target and or prolong the active insulin time. And we recommend optimizing the utilization of the CGM sensor and SmartGuard feature. Just like in this case, you see that the SmartGuard is used in this patient for 88% of the time. The more this pump is automated, the better the outcome is. Another feature that our patients can utilize when they use the 780G system during Ramadan is the temporary target. You could see it here in the dotted green line. So this is a feature that increases the glucose target from 100 or 110 or 120 all the way up to 150 to decrease insulin delivery. Patients can utilize this feature if glucose is trending down during fasting. And we also recommend the use of or the adjustment of the manual basal setting as a backup in case the patient goes without a sensor. Then the pump will have to go to a safe manual basal rates during fasting. And you could see in this example, this is the basal settings for Ramadan that we activated at the start of Ramadan as a backup plan in case of exit from auto mode. The other thing that we emphasize during or before Ramadan is to make sure that the suspension before low feature is activated in case the patient gets out of the auto mode to the manual mode. So with this, I hope that I had provided you with an overview of how to optimize the use of open loop insulin pump systems and also the closed loop system. And I thank you for listening and wish you a wonderful rest of the conference. Thank you.